So, you might have heard the term eardrum retraction before, maybe at an ENT's office. It basically means the eardrum is getting sucked inward. But what does that actually look like, and why does it happen? We're going to break it all down with a really clear visual guide.
Okay, so here's our game plan. First, we'll cover the basics. What is eardrum retraction? Then, we'll look at the two key weak spots where it usually happens. After that, we're diving deep into how doctors grade the severity using two different systems, one called SADE and the other TAWS. And to wrap it all up, we'll talk about why all this grading stuff is so incredibly important for a patient's health.
All right, first up, what is eardrum retraction? At its core, it's all about the eardrum being under pressure. And believe me, the difference is night and day. On the left, you've got a healthy eardrum. See how it's kind of pearly and smooth? Now look at the right. That's a severely retracted eardrum. It's been sucked so far inward that it can actually start to wear away the tiny, delicate bones you need for hearing. The stakes here are really, really high.
So what's the culprit? Well, it usually comes down to your Eustachian tube. Think of it as the pressure release valve for your middle ear. When it's not working right, it can't equalize the pressure. This creates a vacuum, a constant negative pressure that literally pulls the eardrum inward, dragging it away from where it's supposed to be.
So when a doctor looks inside your ear, they're playing detective, looking for specific clues. For instance, the handle of the malleus bone, one of the hearing bones, it starts to look more horizontal than it should. Another part of that bone, the lateral process, suddenly looks way more prominent. And probably the biggest giveaway, that little cone of light you see in a healthy ear, it gets all distorted, or poof, it's just gone. These are the classic red flags. Okay, so here's something important to know. The eardrum isn't just one big sheet. It actually has two different parts, and a retraction in one spot can be totally different from a retraction in another. Let's dive into these two weak spots. Think of it like this. You've got the pars tensa, which is like the main sail of a ship. It's big, it's stiff, it's strong, with well-organized fibers. This is what does most of the work for hearing. Then you've got the pars flaccida. It's the smaller, floppier part at the top. Its fibers are way less organized, making it structurally weaker. So you can probably guess which part is more likely to get sucked in when the pressure drops, right? Yep, the pars flaccida.
All right, let's tackle the pars tensa first, that big, tough part of the eardrum. To classify retractions here, doctors use a system called the SADE classification.
It's a 5-step scale, basically. It starts at grade 1, which is just a slight retraction, and goes all the way up to the most severe stages where the eardrum is literally stuck to the back wall of the middle ear, or even has a hole in it.
Okay, so check this out. This is a grade 1. It's pretty subtle, right? The eardrum is just a little bit pulled in. The really important thing here is that it's not touching any of the hearing bones yet. But see that? The cone of light we talked about is missing. That's your first warning sign. Now we're at grade 2, and things are getting more serious. The pocket is deeper, and now the eardrum is actually touching one of the tiny hearing bones, the incus. As soon as it makes contact, that's a big deal. It's a major step up in severity.
Next up is grade 3, which has a fancy name, middle ear atelectasis. All that really means is the eardrum has been pulled so far back that it's now draped over the promontory. That's the inner wall of your middle ear. The key thing to remember for grade 3 is that it's touching, but it's not actually stuck to it. Not yet, anyway.
And that brings us to grade 4, or adhesive otitis media. Adhesive is the key word here. Now the eardrum is firmly glued to that back wall. This is where really bad things can start to happen, like the hearing bones themselves getting eroded. You can see here how it's starting to damage the stapes, which is absolutely vital for your hearing.
Okay, we've covered the pars tensa, now let's switch gears and talk about that other spot, the pars flaccid, that smaller, floppier part up top. It has its own grading system called the TAWS classification. This one's a 4-grade system. It follows the progression from just a tiny dimple all the way to a deep pocket that actually starts eating away at the bone in the attic, which is the little space right above the eardrum.
So it starts out small. A grade 1 is just a little dimple. Then in grade 2, that pocket gets deeper and starts to stick to the neck of the malleus bone. At this point, you can usually still see the whole pocket, you can see how deep it goes, but by grade 3, things get a lot more concerning. The pocket is now so deep you often can't even see the bottom of it. And here's the really big deal. It's started to erode the bone, specifically a part called the scutum, which is the bony wall of that attic space. That's a serious sign.
And then you have grade 4. This is the most severe stage, where there's major, undeniable bone erosion of that attic wall. The damage can be really extensive, sometimes involving the other hearing bones too. The pocket is so deep and the damage so significant that it's often impossible to see where it ends.
Okay, so we've gone through all these grades for SATE and TAS. But why? Why does all this matter? This isn't just about putting labels on things. This is where it gets real, where it has a huge impact on what happens next for a patient.
This quote here from the journal Medicina really says it all. The key point, the absolute #1 reason to grade these retractions is the risk that they'll turn into something called a cholesteatoma.
So, how does a simple pocket become such a big problem? Well, these deep pockets are the perfect trap. Skin cells, or keratin, flake off and get stuck in there. Normally, your ear cleans this stuff out, but it can't escape from the pocket. So it builds up, gets infected, erodes more bone, and eventually forms a cholesteatoma. And that's basically a destructive cyst of trapped skin that can cause some serious damage.
And it's not just about potential damage. It has a direct effect on hearing. Just look at this data for pars tensa retractions. There's a clear line here. As the SATE grade gets worse, the hearing loss gets worse. You can see the median air bone gap, which is how we measure this kind of hearing loss, jumps from around 7 decibels in the early stages to over 30 when things get severe. It's a direct correlation.
But, and this is a really important but, check out the data for the pars flaccida. It's a completely different story. The hearing loss is basically the same across all the grades. It doesn't get predictably worse as the pocket deepens. What does that tell us? It means for these kinds of retractions, you can't rely on a hearing test to tell you how bad the problem really is.
And that brings us right to the fundamental question that every ear specialist faces. Is this little pocket just a stable quirk of the eardrum that can be watched, or is it the beginning of something much more dangerous on the path to becoming a cholesteatoma? That's why being able to classify and monitor these retractions isn't just academic. It's absolutely critical to making the right call for the patient and stopping a serious problem